Victoria's health system is not under crisis. It's near collapse. Mismanagement, drastic underfunding, severe cuts to services, a mass exodus of staff through resignations and shortages, and an ongoing failure to attract highly skilled personnel has meant Victoria's health system teeters not only on collapsing, but is putting at risk the lives of all Victorians. Now, Victoria's health system cannot be reflected by any colour code, red, brown, green, that describes the chaos the health system is in. And the death of a 70-year-old man on Monday at Bairnsdale Regional Health Service in East Gippsland reinforced the shambolic and deadly state of the state's health system, and how a lack of ongoing investment has led to a system where decay and deterioration of the health system and mismanagement could well be at a point of no return for Victoria. And it has been Dan Andrews who has been solely responsible for the disastrous state Victoria's health system now finds itself in. Andrews, throughout the entirety of his political career, has held just two positions: as a Minister for Health and as the Premier, providing over two of the most crucial roles of the state, excluding that of the Treasurer. And he has solely been responsible for their destruction, decimating Victoria and Victoria's health system. And regardless of whether Jenny Mikakos or Martin Foley held the health portfolios, it has been Andrews who has been pulling the levers and directing policy. And it has been Andrews' gross mismanagement and failure to invest that has contributed to the suffering and death of Victorians, and the risk Victorians face daily because of that gross mismanagement. The death of the 70-year-old man at Bairnsdale Hospital, laying on a stretcher, waiting for more than 3 hours for treatment, is a reinforcement of that very mismanagement, and how Andrews' failure to invest in the state's health system is contributing to death and the Russian roulette Victorians face as Andrews and the government gamble with the lives of its people. Regional-based doctors continue to face the increasing challenges on a daily basis of treating people in corridors, while struggling to find intensive care beds for the most critically ill. The 70-year-old man was not only taken to hospital by ambulance, but was waiting to be seen alongside other patients for over 3 hours, lying on stretchers in emergency. Bairnsdale Regional Health Service, according to one source, said the hospital continues to face increasingly desperate situations amid severe staffing shortages and ambulance ramping outside the hospital, and it is rife and the worst it has ever been. Now, Bairnsdale Hospital, which has 51 acute beds and 20 rehabilitation beds, was so full of sick patients that staff are being forced to treat people on stretchers in hospital corridors because of that lack of beds. Hospitals in Melbourne and regional Victoria see patients facing harm because of delays in receiving critical care. Now, in some of the hospitals, staff are working hours of overtime to keep patients alive until an intensive care bed could be found in Melbourne. Dan Andrews has proven to be a failure as a leader and a Premier. But as a Premier, he has also shown he is detached from the parlous state of the state's health system and a callous and indifferent regard for the safety of Victorians. Now, COVID can't be used as an excuse for the state of Victoria's health system, because the problem has been endemic long before COVID's arrival. COVID may have exacerbated the issue, but even then, COVID's impact has not overwhelmed the health system, regardless of what rubbish or spin the government try to use. The unfortunate death of the 70-year-old directly reflects what happens to a health system when that health system is completely overwhelmed. Victoria's emergency care workers continue to do their best, but the challenges they now face are overwhelming, unacceptable, and completely predictable given Andrews' mismanagement.